give everybody a few minutes to get on into the chat and get their questions ready for our guest this week. Before I dive on into things, welcome to our weekly chance to connect with our NJ Mom community. My name is Marissa, for those of you who might not know me. And I always like to start these chats that we do weekly sort of the same way. So please let us know a little bit about you. Let me know where you're from, how old your kids are, if you are a new follower to NJ Mom, or how long you've been following, and if this is your first time joining us for our Tuesday night weekly check-in, please let me know. And if it is, welcome. We're so happy to have you here. And if you are a familiar face, as hopefully I'll see here shortly in the comments, welcome to you too. We always love seeing you week after week. And I know it's a busy week for everyone, and a strange one, as we're very used to by this point in 2020. So let us know a little bit about how your week's going and how things are faring for you and for your family. We have been doing these really since the start of the pandemic in the spring, and we also each week really like to just give a moment to thank all of our essential workers at the start of this talk. I know many of the moms who we see here weekly are frontline workers, or their spouse is a frontline worker, or someone in their family, or someone that they love. And so we just always like to shout that out and give that moment of appreciation. And it's certainly apropos tonight with our special guest who will be joining us in just a few minutes. So if you're here, you probably see what our topic's going to be for this week, which is cold and flu season during COVID. And I know as moms, we have a lot of questions about that. So start to think about what you'd like to ask Dr. McDonald once we bring him in a few minutes. But first, just a couple things I want to highlight for you that we've been working on NJ Mom that I want to make sure you've seen on the site. So we do a weekly series, if you're new around here, called NJ Mompreneur of the Week. These go out every Monday, and they are definitely a favorite for all of our NJ Mom community. But I really love them because they always leave me with a little inspiration to start my week, where we highlight a mom and an entrepreneur in the state who's really just doing amazing things in terms of her business and also her parenting. So we always tell great stories with these. And this week we have Amy Hughes with Maplewood Mercantile. Now, just looking at this, I love Maplewood. It's just such a great town, but I had never been into the store. And after reading this article, it's definitely on my list to go because it's super unique and cool. And she's also a fellow former journalist. So that intrigued me. Many of you know I lifelong or career-long news anchor before I started working with NJ Mom a year and a half ago now. So always love to see how journalists are, kind of moving into the next chapter of their career. So I found that fascinating. But nonetheless, the store is beautiful. So give a look and learn a little bit about Amy if you haven't already. We also do a weekly series that you guys love. 9 kid-friendly things to do this week. Always love to see the great ideas that our NJ Mom contributors come up with for this. And this week we have a bunch of good ones, but I liked the walk in the winter wonderland with vintage figures and holiday magic at Maple Leaf Farms Christmas walkthrough experience. I know obviously the holidays look different, and so we're looking to do sort of some different traditions this year. And so a walkthrough, a drive-through experience. We've been hearing from all of you how much you want to see those and just find out about the ones closest to you and what's going on. So that's one to check out. There's also the Winter Village at the Red Hill Museum, and that is a festive outdoor craft market. So again, something we can do, bundle the kiddos up, stay socially distanced outside, and just get into the holiday spirit a little bit. And then I know that everyone will be looking for this come this weekend. We've already started talking about it in my family, but this article is the best Christmas tree farms in New Jersey to cut your own. So if you've never done that before, you're looking to start this year, there are a lot of great options. And so we've rounded up, the best of the best for you to give a look at. So check that out if you haven't. And as always, we'd love to see all of your pictures when you hashtag NJ Mom when you tag us in your photos, both on Instagram, on Facebook as well. On Facebook, we actually choose 5 fun new cover photos every week from your submissions. We get so many, and we just always love to see them, and they always brighten my day when I, scroll through on Facebook or Instagram to see, and the whole NJ Mom team feels that way. So we love to reshare and feature them on the site. We do roundups all the time, as well as on social. So don't forget to tag and use the hashtag NJMom so we can find yours. And if you want to be our Facebook cover photo of the week, by the way, you just have to comment a picture on that post on Facebook. So definitely check that out. And we choose 5 new ones every week. So maybe we'll choose yours. And hopefully we'll see some pictures of you guys enjoying our NJ Mom, NJ Baby Expo that we had over the weekend. If we have any new mamas coming in tonight who are new on Tuesday nights because of the Baby Expo, if you're expectant, if you're a new mom, just gave birth and you joined us this weekend, first of all, thank you for being with us. It was a fantastic weekend, a fantastic virtual event. And I know so many moms were excited to see what else NJ Mom does and how we sort of offer this community for you to feel supported and just have a partner to go along with your motherhood journey. That's what this is all about, especially these chats. I see Nicole's here. Hey, Nicole, nice to see you. Hope you're having a good week so far. I would love to hear from you. If you're new here, please drop me a comment and let me know a little bit about you and how long you've been following NJ Mom, and also what you're hoping to talk about tonight, because this is a great, great topic. Before I bring our guest in, just a little side on why we decided to do this. I mean, we kind of set this up a few weeks ago, knowing that the cold and flu season this year would be, our first full cold and flu season in the midst of COVID. So that carries all of its own concerns and layers to talk about. But, over the past few weeks, obviously, we've had a big increase in cases here in New Jersey, and the holidays are coming up, and so there's so much happening. So it's just, I think, going to be really valuable to have this expert insight from Dr. McDonald, Children's Specialized Hospital. So I'm going to bring him here in a minute. Get those questions ready. Let us know what's on your mind. Also, one other quick thing before I bring him in: anything we talked about, we're going to be dropping those links in the comments for you. So any of the articles I mentioned, if you're wondering where those are on the site, take a look. We'll be dropping those in the comments for you as well. So, okay, I'm going to bring in Dr. McDonald now. Okay. Hello, how are you?
I'm doing well, Marissa. How are you?
I'm fine, thanks. Thank you so much for being here. I know how incredibly busy you are. And I mean, first and foremost, just give some of our moms watching a little background on you and all that you do for Children's Specialized Hospital, because you have a big job.
Sure, thanks. So I'm the Vice President and Chief Medical Officer at Children's Specialized, part of the Robert Wood Johnson Barbie's healthcare system, and in that capacity, I chair the quality for pediatrics for the system at large. But more importantly, to your moms that are watching tonight, I'm a practicing pediatrician there at Children's Specialized. I practice in the primary care practice, taking care of children with special healthcare needs and different medical complexities. Also, probably important to the moms watching, I'm the proud father of 2 young children. So through that, I'm living through some of these struggles during the COVID pandemic as well.
Absolutely, in a million layers there. I mean, as a healthcare worker, as a dad, and as someone who, is focused on children who do have special health challenges, who are, more at risk for things like that. So, I think you just have so much insight. And we talked before this, and we were just talking about some of our own, sort of parenting decisions that we've been faced with as the weather's getting colder, and, the cases are on the rise. So I think first, maybe just let's give everyone watching, can you give us a general idea of kind of what you've been seeing over the past few weeks, and what the scenario is right now in terms of pediatrics and the COVID situation?
Sure. Yeah. So overall in the country and in New Jersey, we're certainly seeing a rising number of cases, and unfortunately, a rising number of deaths associated with those cases. By and large, the number of cases is rising much faster than the number of deaths, which is very important. In the pediatric community, just like we saw in the spring, children are fortunately much less affected, both in number and fortunately in the severity of cases. So we are seeing a rise in the number of cases within the pediatric population or children, but again, to a much lesser extent than, say, my adult colleagues in New Jersey and in the country.
And so what, I guess, is your broad advice to moms who are looking to kind of prepare for what is going to be a long winter, an unusual winter in many ways? You know, our kids get sick all the time, right? So as young children, they have colds and runny noses and all of these other things. So what can you tell us about how to approach this year and how we should be approaching it differently?
Yeah, so that's a challenging question, challenging time for parents. I think the broad advice I would give is to continue to apply common sense and the fundamentals we have that combat viruses. So we have so many tools in our toolbox, if you will, to prevent the spread of viruses, and that includes common sense. If you're sick, or your child's friend is sick, or Aunt Jane is sick, avoid that and communicate with your friends and family members. The second being hand washing. Again, it's a fundamental defense against all infection, and something sometimes we forget about and forget to do. So be vigilant in that regard. I think what's really different about this winter as opposed to other winters is what to do when our children have an illness, or how much we should keep our children in activities or out of activities. And I'm sure your viewers will have some questions about that I'd be happy to address. And then the last broad sweeping advice I'd give is to remember that physical health and emotional health or mental health don't stand alone. They're intimately tied together. So while we may need to have times where we physically distance ourselves, it is really important to find emotional health outlets and social connection in probably a different form than we're used to.
And, you know, at this point, we've been doing that for many months now and trying to find those ways, but it is very hard, particularly for kids. We already have a bunch of questions from people watching. So let's get to some of these. First of all, just a hello to Susan, who's new to NJ Mom, lives in Montville, mom of 3 teens. Hi, Susan. So happy you're here. She actually owns and operates a child's care center in Fairfield. She said some students have started with runny noses, low-grade fevers, and/or congestion. So at what point should I exclude a child from our center? And when should I mandate the parent to get the child tested for COVID? These are some of these really gray areas that I think you were mentioning that are going to be really challenging this winter. But any advice for Susan on how to kind of approach things?
Yeah, Susan, congratulations for answering the most difficult, for asking the most difficult question. So this is a struggle. So I'll give you some overarching advice. It is effectively impossible to tell the difference, particularly in children who are well, the difference between COVID-19 and the run-of-the-mill viruses that children get time after time, particularly in your setting, Susan. So any child that is symptomatic should probably consult with their pediatrician to help use the tools that the pediatrician has to distinguish COVID from non-COVID, if you will. But before we get again to COVID, any child that has active fever or has had fever in the last 24, 72 hours is a no-brainer that they shouldn't be in school or in any communal setting. Any child that's unwell obviously should not be out and about and should seek care with your pediatrician. What the pediatrician has that others don't is the capability to test for other viruses that might help inform when a child returns. And then, of course, many pediatricians have the capability to test for COVID. So I guess the short answer to that question is if a child is symptomatic, especially in the wintertime with the current level of circulating COVID-19, they should not be in activities.
What about those run-of-the-mill runny noses? Like you and I were talking about. So I have a almost 16-month-old. And, you know, that's like the age where it kind of starts. Like she had one a couple of weeks ago. And I mean, she's not around other kids other than my kids at this point. But I still was like, well, should I take her? Should I call? Like, what do you, I mean, she didn't have a fever. She didn't have a cough. It was just really like a runny nose. And it wasn't even that bad of one. But these are the things that we moms are kind of, you know, looking at totally differently than we have in past years, and dads. So what do we do in a scenario like that? How do we look at it?
Well, because the symptoms, again, in children who just have a runny nose and are otherwise well, because those symptoms are difficult to discern from influenza, sometimes difficult to distinguish between infection and allergy. Those children should be tested if you want to know whether or not they have COVID-19. And I think where that becomes more important is depending on where the child is going. So if a child is going to go to school or is going to expose a daycare or is going to be spending time with loved ones, then that testing becomes more paramount because the risk is greater. If a child is 16 months old and is not going to be leaving the household and is just going to be with, like you in this case, then the impact of testing is not going to change the course of treatment, presuming that the child stays well. So you might not opt to test, and pediatricians will opt not to test if it's not going to change the course of the disease. Or it's not going to change your behavior, meaning keep her out of school or keep her out of daycare, etc.
Okay, that's good to know. Nicole wants to know, she works in a pediatrician office. She's testing in a large amount of children, young adults, all ages for COVID, flu, and strep. A lot of the symptoms are presenting very similarly. She kind of was echoing the same thing. Any advice you can give us for navigating the different symptoms? But essentially, that's a hard nut to crack because they are so similar. There really isn't, other than testing, is there anything that we can do sort of on our own as parents?
Well, one important part about COVID is really understanding whether or not someone has been exposed to COVID, because that will change what you do about that. If you know that there's been exposure in a close contact, then that will influence whether or not that individual gets tested. Your pediatrician can do some physical exam things to distinguish between strep and COVID, or even strep and flu for that matter. For example, the presence or absence of cough. But generally, COVID-19 and all other viral illnesses, really difficult to tell the difference without testing. Some pediatricians' offices, I think Nicole had mentioned flu testing. So, you know, if you had flu testing available, that's helpful. And some pediatricians actually have COVID testing in office, which is also helpful. And Nicole, thanks for continuing to work at the pediatrician's office through all this. I'm sure your work is very well valued, as Marissa said at the top of the show.
Yeah, it's so true. Nicole joins us every week. So whenever I give that essential worker shout out, I'm always thinking of her and her husband, both frontline workers. So Thank you for saying that. And one great question from Adrian, I think that you have, sort of some good insight on this given your line of work. So she says there are many moms like myself who have a child with a disability. We all know it is to support them, to be safe, to wear PPE and socially distance. So many times we hear if you're at risk, stay home. Often feel excluded in many things in general. But how can we feel connected and included in real life experiences through COVID, especially through flu season? I'm sure you've heard this from patients of yours in some capacity over time. What advice do you have?
Yeah, so first and foremost, and Adrian will know this, the children with special healthcare needs have certainly a special place in my heart, and are disproportionately affected by COVID, depending on their underlying diagnosis. So what I mean by that is that children with significant medical complexity may be more at risk for the complications of COVID. But what is even more prevalent is that children with special healthcare needs are going to have a harder time with the indirect consequences of COVID. So you could imagine how difficult it is for a parent to try and educate your 7-year-old virtually, or a 4-year-old virtually. Some of my personal patients and some of our children's specialized community are living, breathing examples of this, where we're trying to educate, for example, children with autism. It's just tough for families. So the advice I guess I would have for Adrian is to find ways to stay connected, find ways that we combat that isolationism that can happen, and to continue to include children in all the activities they can be in without undue risk.
Do you know of any like online groups or anything like that that are doing anything special related to that at the moment? Have you heard of anything like that at this point?
We have some online support groups that are available through Children Specialized. I could probably get that information out to you offline or online after the chat.
Great, wonderful.
And then quite frankly, we have a team of individuals at Children Specialized that would be able to answer that question in a better way than I can. So if some of the viewers have questions about that, I can get them the resources that might be helpful.
Yeah, that would be great. And Susan, who initially commented above about her daycare center, she said, thank you for the info. What temperature she wants to know, what temperature would be considered a fever? Our usual guideline is anything over 101, excluded. But with COVID now, has that changed at all, or should that be changed?
Yeah, so the definition of a fever from a medical perspective is 100.4, 100.4. Traditionally, people use 101, but it doesn't have to be 101 to have an infection. So we use 100.4, and that's standard within the pandemic and beyond. Okay,
so that should really be what they should stick to. Okay. Well, just a nice comment here from Glennie. She says, I'm new to NJ Mom, but I just wanted to thank Dr. McDonald for his hard work at CSH of New Brunswick. As a mom of a young girl who was just there, I'm really happy with the services. So, mom of a girl who's planning to attend Temple University, Philadelphia. So I'm not sure if you know who that is, but she just wanted to give a nice shout out to CSH.
Yeah, thanks, Glennie. Not only do I know who that is, I'm the one that should be thanking her. What a privilege it was to take care of her daughter. I can't disclose too much because of the HIPAA rules, but I will say she's just her daughter's an amazing person, and when I walk in the rounds at the hospital, she gives us quite a bit of inspiration. So thank you.
Oh, that's amazing. All right, so let's dive back into our topic here. So obviously this week is Thanksgiving. There's been so much talk about the holidays as a whole this year, and what to do and how to approach it and all of that. We're going to dive into that whole topic actually next week a little more, just a little teaser for all our moms. But from a medical perspective, can you tell us like a little bit about the conversations you've been having with your patients and parents about this, and maybe some perspective of your own, what you've been dealing with as a family in terms of how to approach this?
Yeah, so specific to the holidays, Marissa, or gatherings, what's pretty clear about COVID is that the spread occurs when there's large groups of people or people within close contact, meaning less than 6 feet, longer than 15 minutes. So, beyond guidance that's available to everyone through the CDC or policies that are given to us by the governor's office, for example, I think common sense is again the first barrier here. What I mean by that is be in communication with your family members. Know who has been sick, who has recently been exposed, and pay attention to that. The smaller the number of folks that are together, the less risk we pose for transmission and even asymptomatic transmission. And then individually, the risk is the greatest to the elderly and those with significant underlying conditions or both. So those are conversations that I have with patients and with family members actually alike. So you really want to avoid exposure to those individuals within your family or beyond. And then beyond that, I think that during these events, I think what we want to think about is, Thanksgiving is one day or a couple days that I think is probably going to look different this year, and that's okay because together we'll eventually we'll get through all this and hopefully live on to have a bunch of holidays with our family members the way we would like in the future.
I think that's good to mention. I know you and I talked about this, over the phone when we were kind of doing our prep for this night. But I think a lot of moms maybe have help from parents and things like that for childcare, and obviously over the past several months, as things have changed and adapted, like for my family, for example, like we have regular contact with my parents, and we're sort of starting to evaluate everything in a larger way now. But going into the winter, like say you have your so-called bubble or your quarantine or whatever you want to call it of people you regularly see, you don't see people outside, you're kind of keeping to a very small circle. Is there a point we should think about being totally back to just our household all the time? Or like, how should we sort of inform ourselves in the best light to be able to make those decisions as things change throughout the winter? Yes, that's what I'm asking.
Yeah, that's a tough question. I think it's an individual decision. I think it depends on who lives in your household, frankly. And I don't pretend to have all the answers in that regard. I think that if you have an individual who's at high risk, particularly individuals over the age of 75, 85, or individuals over 65 that have certain health conditions, that's going to weigh heavier on the minds of all of us than if you had a typically developing 9 and 11-year-old like I do, because the risk to those two individuals is far less. So when I want to protect folks, it's not for selfish reasons or for family reasons, it's for public health or for selfless reasons. So I think that it's a tough individual decision. What I would advise, because there's so much data out there, and sometimes the data is accurate, sometimes the news is fake. There's an incredible resource we have in this country on the CDC website, and it's easy enough to get on there and just peruse it and deal with facts and deal with real numbers, and then make a decision accordingly. And if you go through that site, you can actually see how many cases are in your state or in your county, for that matter. That's something we monitor very closely at the hospital. And that might help you to make some of those decisions that really don't have a black and white answer and are more gray. So for example, if you note that the viral level is low in the state or in your county, which it's not today, it's high everywhere, then you might make a decision based on that data. And it's not that difficult to peruse.
Mm-hmm. I think that's important, is what you just said, is that there is a lot of gray. There's a lot of things that, frankly, through this all, as we all well know at this point, change, week to week. I mean, what we were talking about 2 weeks ago is completely different than what we're seeing now. And obviously what we saw in August is completely, so yeah, I think it is very important to stay on top of that information. I appreciate you saying that. A couple more great questions here. Danielle says that she just had a baby and she has a 2-year-old. How susceptible are newborns to COVID? Should I be taking more precautions than the normal with people wanting to meet the new baby? Which I think she means the normal precautions are don't visit if you're sick, good hand washing, but what should we do beyond that for a newborn?
Yeah, thanks, Danielle, and congratulations on the newborn. The data that's released pointed to the fact that babies less than 6 months old are a little bit more at risk for hospitalization than our children of different age. That is, it's not profound, and it's pretty consistent with all viral illnesses. When babies less than 6 months get what would be a typical cold, they can be hospitalized for lung infections, and that's not unusual. So for a newborn or less than a year old, be a little bit more careful, maybe a little more communication with people that are visiting, and then of course, hand washing and sanitation techniques. Otherwise, the brand newborn, if you will, less than 2 weeks old, and pregnant mothers actually are not being disproportionately affected by COVID, which is a positive. So what I mean by that is babies who are born 0 through 2 weeks of age, we haven't seen too many of those babies, fortunately, getting sick. Once they leave the hospital but are still less than 6 months old, they're going to be susceptible to being hospitalized from all viruses, including COVID. So I hope that gives you a little bit of insight and information to use. And congrats again.
Yeah, congratulations, Danielle. Emily, you're welcome, Emily. She said, thank you for taking the time to have this live session. This is a question I know is in the minds of many moms as well. With the looming manufacturing and distribution of an effective vaccine on the horizon, would this be a vaccine recommended for the pediatric population, given the lower number of COVID cases and deaths we're seeing in children? So I know that it's going to be obviously in order of need, frontline workers, those most at risk obviously will receive it first. We've heard that over and over, but that's an important question to think about with kids.
Yeah, so if you don't mind, I'll just talk about the vaccine in general. So the fortunate part of the vaccine is that there is a vaccine coming, and the early news is promising. Maybe as early as December, small numbers of high-risk patients and healthcare workers will receive the vaccine. This includes adults only. The data that you hear in the news is not data that included pediatric patients. So when you hear about 95% efficacy, that's not talking about children. So it remains to be seen if the vaccine will be utilized in kids. You know, Emily, you make a good point about the low number of deaths, really, in children. So we may not see the vaccine be utilized for the benefit of kids. However, oftentimes we all receive vaccines that aren't going to affect us in that very moment, but would protect a different portion of the population. The couple of the easy ones in that regard are the HPV vaccine, which prevents cervical cancer in women, is administered to children at approximately 11 years of age, or boys approximately 11 years of age, because it's protective and now proven to reduce cervical cancer in women. So it remains to be seen. It's not going to be on the first wave for sure. The vaccine will not be given to children in the first wave. What will probably happen is, number one, it'll be studied by the manufacturers at first in the pediatric population, just to see if it's efficacious and to see also if it has a different side effect profile as compared to adults. And then ultimately, I think that for how well we do with the vaccine in the adults will inform whether or not it's given or even mandated for kids in the future.
Adrian actually followed up with that, and I think you just answered that for the most part, but she was wondering if those clinical trials included children. So you said they did not.
Not the published data.
Okay.
It's my understanding that there may be some trials ongoing, but I don't believe that the current vaccine news includes trials in children. I'm 95% sure of it.
Okay. What can you give us any insight into, you know, we did hear that here in New Jersey in December, we may see some small numbers. Have you heard any update on if that in fact will happen, and kind of when we can expect more to be in New Jersey? I mean, I know that you're not on the vaccine side of things, so to say, but as someone so prominent in the medical community, I don't know if you're able to share any of that information.
Yep. So the optimistic plan is December for distribution to high risk. If not December, then early in the year. We as a healthcare system, Robert Wood Johnson Barnabas Health, will be looking forward to distributing the vaccine when the time is right. So we are actually planning for that distribution, both within the healthcare system and to the public at large. So preparing things so that we're ready when the time comes.
That's great.
So when it's available to the public at large or in mass number remains to be seen. But it's certainly optimistic news. It would be pretty tremendous if we had an effective vaccine and we weren't talking about how many people we're going to have at Thanksgiving next year.
Yeah, let's hope so. So Christine just jumped in kind of back to sort of what we were discussing before a little bit, but this is a good one because we kind of mentioned allergies in the mix, but then, you know, she wants to know allergies versus cold versus flu versus COVID. Like, is there a breakdown we should be thinking about? I've seen some charts online and things like that of the slight differences in this, but what's your overall advice on these sorts of things?
Yeah, I mean, my first advice is that it's challenging. We were actually talking about this today with a very well-respected infectious disease colleague of mine and how difficult it is to tell the difference. Christine may have missed a little part here, but distinguishing between COVID and flu and other common viruses like rhinovirus, enterovirus, forget it. It's almost impossible right now. Allergies and viral illnesses, there are some subtleties that can be teased out. The seasonality, for example, you know, what season it is will increase the likelihood of allergy. The presence of fever is a big one. So if you have a fever, then you have an infection as compared to allergies. Allergies don't cause fever. So if you have fever and congestion, those are little clues that might tell us about what the problem is. And then after that, there's some physical examination findings that your pediatrician would tease out to try to tell the difference. It's challenging.
Mm-hmm. I think that I heard this, sort of earlier on in the pandemic I think it explains it well, is that, COVID really comes with such a wide range of symptoms that have really made it tough to distinguish, because normally you would say, okay, if someone is vomiting, they don't have a cold, it's something either, gastro going on, but the fact that COVID has had some of those gastro symptoms as well as the respiratory and things like that, is that what makes it so challenging? Is that the COVID symptoms are sort of so wide ranging?
Yeah, it is a challenge. If you look at the list of COVID symptoms and you cut off the questions about exposed to a case of COVID or lost your sense of taste
or smell, right?
And you just look at it: fever, cough, congestion, runny nose, vomiting, diarrhea. They're all common symptoms of viral illnesses, particularly in young children. So where you or I, Marissa, might get a classic cough and cold, young children, toddlers, infants, they might get fever, vomiting, diarrhea, cough and cold, all overlapping with the COVID-19 profile. Challenging.
Yeah, and Christine was mentioning that checklists will ask for like runny nose or congestion. I'm not sure, Christine, if you meant the checklists for COVID or like the sometimes when you look online. I know this because I think everyone has, as a parent, has sort of Googled this, like in anticipation of this cold and flu season. How do we tell the difference? And sometimes it will say that like runny nose is not as typically a symptom of COVID. It's more, the nasal stuff is more something of like a cold. But from what I'm hearing from you, that's like it's not really 100%. You can't really like rely on that.
Right. Well, I think what Christine might be referring to is if you're asked about the symptoms of COVID and you say, I have a cough and congestion, but you have allergies, then that's going to screen you positive for COVID-19, where in fact you might have allergies. So it's just, it's the same church, different pew, if you will. But that's a challenge. That's a challenge for us because we are very specific about entering our hospitals and screening and taking temperatures. And, we have people with allergies, and we know that the symptoms overlap quite a bit. So we stay on the conservative side. So if you say you have congestion or cough, we assume COVID until proven otherwise. Yeah.
Oh, Christine clarified, she's talking about school entry. The schools in her county went all virtual starting this week till January 19th, as many of the districts have. And so so that is, in your mind, how schools should operate more on the conservative side of things versus, it's probably allergies, it's fine.
Right. And especially this time of year. And especially given the number of cases in the community, if it was May 15th and the cases in the community were very low, and the child has seasonal allergies every year, then maybe it's a different kind of conversation. But with the percent of people in New Jersey with COVID-19, I would err on the side of caution.
Mm-hmm. Natalie's comment is interesting too. And I actually wondered this myself. Do COVID tests show up positive if you have another virus like cold or flu? Do you recommend getting a COVID test as a rule out if you have cold symptoms?
So to answer the first part, no. The COVID test is specific to the DNA of that virus or to markers that are on the outside of the virus. There's two common tests. One's called PCR.
Right.
So that looks at the effectively the DNA of the virus, and the other is an antigen test, which is a quicker test that looks at markers that are present on the virus. So they're specific to COVID-19 for the most part. And then the second question, which is recommending a COVID test as a rule out for symptoms, I think that depends on what you're going to do with that information. I think, again, given the number of cases in our communities, it's probably a good idea. Just to tell you an anecdotal story, my daughter had a cold. I lived through this 3 weeks ago. She was fine. Her pediatrician didn't opt to test her, which I think was a fine decision because it wasn't going to change what she was going to do in the future. Unfortunately, she was very well. I, on the other hand, of course, eventually developed symptoms of a cold, but because of my role in the hospital and because being responsible in a different way to patients and staff, I opted to get tested because it was going to change what I was going to do. So it depends on what you're going to do with that information. But for the public health standpoint, it's a really good idea that if you have cold symptoms right now to get tested, because it's gonna really inform action, and it's going to protect other people, or at least keep other people from getting sick and having to quarantine for 14 days at a time.
Mm-hmm. Yeah, very good point.
In the future, or if you have risk factors, there's some treatments coming out that for most of us probably will not be necessary because COVID will be run its course. But if you have some underlying risk factors and you have COVID, there's some treatments coming that will be used routinely to prevent the consequences of COVID-19.
Mm-hmm. This was a question from Stacy. My young children have not been back to school / daycare yet. Is it best for me to wait until after the holidays to send them back?
I mean, I think from an infection prevention standpoint, they're going to be less likely to get COVID or get other viruses being in the house. So from looking at it strictly from an infection standpoint, that would be my answer. The rest of it, the wellness of the family, the wellness of the child, in other circumstances such as employment and having to work outside the house, that would weigh on that decision or the advice I would give. So I don't want to, ask you all those questions at this time.
You're answering is from the infection standpoint, but also from the dad standpoint. And
Right.
You get it. You know that there are, listen, these are not easy decisions. If they were, I think everyone would be feeling a lot different now, 9 months into this. I mean, we know in many cases what the right answer is in terms of infection, but there are sort of, when it's these nuanced decisions, there is a lot of gray. So I appreciate you saying that,
The risk to the child, I'll just say this, if you were in my office, the risk to the child who does not have any other significant underlying conditions is very, very low. And I think that's important to say, because as a parent, we all know the burden of concern we have when making decisions on behalf of our children.
Yeah.
Per data that's pretty widely available, the risk to children without underlying conditions is very low.
A question from Nicole. Any research you have on cardiac pediatric patients and COVID? Nicole's son has hypoplastic left heart syndrome. He's getting I'm not exactly sure how to say this. He's getting Synagis as well for RSV. Is there anything else I can do, as she and her husband are both in the frontline worker capacity? They're both nurses, since their son is a higher risk.
Yeah. So thanks, Nicole. So if he's over age 6 months, another thing you can do is get the flu vaccine, because children with hypoplastic left heart and other cardiac anomalies are at increased risk for consequences of flu. So if he's over 6 months, get the flu. I'm glad that you're getting Synagis for RSV. RSV is a virus, as Nicole probably knows, that is the most common reason that young children are admitted to the hospital. So that's a good idea. And then after that, depending, he's probably too young. So I was going to suggest another vaccine, but he's too young. So I think other than that, it's all the other things that we've talked about tonight. Communicating with family members and putting up the fundamentals of hand washing, practicing common sense, avoiding people that have been sick, and undue exposure.
Yeah, I think all of that is, sometimes it's like we want there to be this, magic answer, and unfortunately it's not that way right now. But we just have to remember that it's all of these things sort of in conjunction with each other, and we're all doing the best we can to protect our families, however we can.
Yeah, Marissa, if I may, I didn't answer
Yeah.
her first question was, has there been research on pediatric heart patients?
Oh, yes.
And I don't believe there has been specifically. There has not necessarily been enough cases of COVID-19 within that population. I said a little while ago that children with underlying medical complexity may be more at risk. So if you want to take that as research, I would go with that, but non-specific to cardiac disease quite yet.
Okay, thank you. Susan has another question, and this is important. I was wondering this too. I mean, my kids haven't had to be tested yet, but I do have one child in a daycare setting, so I've wondered this as we've gotten communication and things like that from the school. She said some pediatricians will not test, but give a letter clearing the child to be at school. How can they be sure if they're not doing that COVID test? Like, what are the parameters of waiting, and what are sort of the ground rules for pediatricians in terms of then clearing kids to be back in a school setting?
Yeah, this has been interesting for pediatricians and definitely a challenge. Before COVID, generally the rule of thumb and the recommendation of governing bodies and infectious disease bodies was that if you're basically fever-free for 24 hours, you can return to school, because otherwise children would have a significant amount of time out of school over the course of a year. And the risk, the longer the illness has been present, the less the risk is of infecting another child. So without testing, you're going to rely on probably time or symptoms. So if the longer the timeline, or the longer it's been since the onset of symptoms, the less likely that the individual is to infect another. So, if it's been 10 days or 14 days, they're probably going to be willing to clear a patient to go back to school because of time without a test. That's been generally our practice, is either test and prove it, or quarantine for time. And some of that has been, the choice there is the parents, and some of it's influenced by the policies of the school.
Mm-hmm. So the school can say, if you don't get a test, you have to quarantine for 14 days and then you come back. If it's, I'm talking about not public school, like a daycare, like Susan was mentioning.
Yeah, I'm not sure if they can say you have to get a test, but I know a lot of the schools and daycares are requiring at least a note from the pediatrician. And then I guess it's up to the pediatrician's judgment as to whether or not they would test or not.
Mm-hmm.
again, the testing is not going to influence the treatment in most of these cases. The testing will influence the quarantine period and inform the community of what actions they might need to take.
This is a question from Christine, but I know that a lot of people, moms in particular, are wondering these things. She says, as a new grandparent, what are recommendations as far as family members seeing the baby in this time right now? Mom and baby live with me. The baby's 4 weeks old. The other grandparents and family are wanting to see him. So this is one of those situations that I think a lot of people are wondering how to approach.
Well, some of that's difficult because in my family, the grandparents just tell us what they're going to do, and then we have to listen. So that might be advice for you, Christine. Again, the older the baby gets, the less risk. So there is no correct answer to that. Again, I would just urge communication with grandparents and being real smart about who's been exposed and who has even small symptoms. Again, I don't worry about the consequences for typically developing children. School-age kids seem to be getting a mild illness. I do sometimes worry about younger infants, particularly those less than 6 months, because the data we have points to the fact that they would be more likely to be hospitalized. So it's probably not an answer to your question, but hopefully gives you a little guidance in making that tough decision.
Would you recommend, this is like not specific to Christine, but I'm just wondering this in general, would you recommend, say, in a situation similar to that, where it is a new baby, the grandparents really want to meet the baby, like if everyone quarantines for 2 weeks, for example, and then decides to meet the baby, or if everyone, quarantines for 10 days and gets a COVID test, and that, I'm sure people are asking you about situations like that. What is the medical advice in a scenario like that?
I think the first advice is that, there's an important emotional component of seeing a baby, and there's emotional components that the baby has.
Oh, I think we lost Dr. McDonald. I really wanted to hear that answer. Hopefully he clicks back on and we can hear him. Oh, here he is. Okay. We lost you for a second. You left me hanging. I really wanted to hear that answer.
I don't know where I left off, but I'll say that, there's emotional health of the baby and there's emotional health of the grandparents. And I think that the family bonding is an important part of that. So I don't want to forego that important part. Mental health through COVID statistically has taken a serious turn in the country with rising rates of anxiety and depression. And you probably didn't need me to tell your viewers that, because I think many of us are feeling it. So I don't want to let that part go. The suggestions you have, Marissa, are actually the answer to the question. They're very, very good strategies. So again, the longer you are without symptoms, the less likely you are to be infectious. So if you quarantine for 10 days by yourself or with one other person, the likelihood that you're carrying COVID to the baby is less likely. And then certainly if you had testing capability, if that was available to you, that would be even more informative, possibly.
Okay, that's good advice. And one last question, because this is something that I know we've been talking about in my family and with friends and things like that. How often would you recommend someone getting tested asymptomatically? So we don't have any symptoms. We really haven't been around a lot of other people. Maybe we'll want to see one other family unit in our family. So should we go get a test even if we're asymptomatic? How often should we get tests if we're asymptomatic? Any insight there? I know right now, obviously, we want people who have symptoms to have access to the test. So that's another thing to think about too. But it's hard to know what the right thing is to do.
Yeah, I think that I think that I wouldn't want people to be tested recurrently who are asymptomatic unless there's a really specific reason for that to occur. And again, it's a risk benefit. So if you're visiting someone that would be very high risk, you might want to opt to be tested even though you have no symptoms. The important part is that, you know, a lot is made of the asymptomatic transmission because it's impossible to know that you have the disease until you have symptoms, right? You wouldn't know it. That's why it's asymptomatic. But it's still an overwhelming minority of patients who have COVID that are asymptomatic. You know, I read a study today that 16% of children with COVID are asymptomatic. So it's less than 1 in 5 are asymptomatic. So, you know, the yield on asymptomatic testing is pretty low. I think it's more impactful to be in clear communication with family members and people you're going to be in contact with who you've been exposed to, and what tiny symptoms we may be ignoring. Because when you have symptoms, particularly in the early going, you're certainly infectious. So it's probably not a clear answer. I don't recommend that to any of my patients to routinely get tested who are asymptomatic. Obviously, from a hospital standpoint and from a regulatory standpoint, we have a significant number of asymptomatic testing to protect our patients. But if you're talking about routine life, I wouldn't recommend it too frequently.
Okay, that's good to know, because some of the commercials too, like it's saying like go get tested, you know, like, and it's hard to really determine like, well, should I do that if I don't, you know what I mean? There's a lot there's so much we need to sort through as individuals, and then on top of that as parents right now. And so we really appreciate you, you know, kind of delving into this all. One more question before I let you go. I want to be mindful of your time, but Nicole, this is sort of related to that. She was asking, are healthcare workers in your hospital regularly testing the employees? Our facility has not initiated that. So you were just saying that does happen at Children's Specialized, but it's not across the board for all healthcare facilities?
Right, and it's not across the board for Children's Specialized either.
Okay, I'm sorry, I didn't mean to, yeah.
Yeah, no, it's my fault. So I saw the next chat, sorry, I was laughing. So we are not routinely testing all healthcare workers in Robert Wood Johnson Barnabas Health at large, or across the entirety of Children's Specialized. We are testing certain cohorts of employees at Children's Specialized because of regulation and because of increased risk to some of our children with medical complexity. So we have to be extra certain. And what that gets at is both the people that might be asymptomatic and also pre-symptomatic. So the people that are sick and don't quite know it yet. So we're extra careful in certain populations. But no, we are not testing routinely. The routine testing did occur across many healthcare systems in the summer and across the country. And the yield is very, very, very low when you test large portions of asymptomatic healthcare workers. So for that reason, currently we don't do that routine.
Good to know. This was a wealth of information. Thank you so much, Dr. McDonald. We really appreciate your time. And just any parting words for, you know, moms watching tonight who kind of, you know, are looking at this winter ahead with some nerves and some questions about how to do it all.
Yeah, I mean, I would say acknowledge that being a mom is a tough job, and that be confident and be happy with the decisions that you make for your child, because these decisions are tough. You heard a lot of gray area tonight and probably a lot of dancing from me where there is no hard and fast answer. And the second thing I'll say is, children need to find ways to connect. They need to be exposed to things that help their development, help their wellness, avoid depression, anxiety. So find ways for your kids to stay connected. And of course, you can't raise healthy kids if you yourselves are not staying healthy. As my wife would tell me, being a mom is the toughest job in the world. Dad, not so much. So find ways for you yourself to stay well and stay connected, and to stay social where you might not be able to be in physical proximity to your friends, families, and your normal outlets.
Which is exactly why we have this every week. That's exactly the reason, to kind of have this space to talk about these things, and also just understand that other people are having these difficult decisions too. One more thing before you go. I'm so sorry, Alicia, I saw your question before and I meant to ask it. Alicia wants to know about whether a 2-year-old should be wearing a mask. I know that the recommendation is like 2 and up, but what, like, child who just turned 2 is much different than a child about to turn 3, and there's a lot of questions about that. So what's the medical community's stance right now on that?
2 and up, the stance is wear a mask where it's appropriate to wear a mask. So in those community settings where mask is mandated, 2-year-olds can do okay with it, particularly typically developing children. So yeah, we endorse the mask in the 2-year-old, and quite frankly, we've been surprised by the children and how resilient those little buggers are. They've been pretty cooperative with things, which I never would have thought. So yeah.
I think some of the question, and Christine just weighed in on this, and I know from my own experience, like at daycares, 2-year-olds are encouraged to wear a mask, but not expected, and it's not mandated at that age. So is that okay?
Well, yeah, they're 2. So we can encourage 2-year-olds to do a lot of things that they won't do.
Sure, we can.
So I think you do the best you can, or you put other precautions in place. That's what we've pretty much subscribed to. We understand that 2-year-olds or even other children with special healthcare needs, autism, etc., are not always going to want to wear their mask, and it's not reasonable to think that they would. So we put other precautions in place to protect ourselves and to protect other families.
Thank you so much, Dr. McDonald. Really appreciate your time once again. Have a happy Thanksgiving. And I know all of the moms watching tonight really appreciate all of your thoughtful answers. And, we understand there's gray. That's life. I mean, anyone who, we would all love it if it were very black and white, but that's just not. So really appreciate all of your insight.
Well, thanks so much, Marissa, and thanks for having me. I actually enjoyed chatting, and I hope you have a happy Thanksgiving as well.
Thank you. Have a great night.
You too.
Take care.
Bye-bye.
All right, everybody. Thank you all so much. Oh, thank you. Thank you. So glad you guys could be with us tonight. As always, if you have any ideas for topics or guests that you'd like to see come on and talk about different things for next week or in the weeks after, please let us know, and have a happy Thanksgiving, everyone. Stay safe, stay healthy. You're doing a great job. I know it's a tough season all around, and as Dr. McDonald said, we have to remember to take care of ourselves first. So please come Tuesday nights, chat with us. We'll get through all of this together and bounce all of this off each other. So thank you so much for being here. Have a great rest of your night, and happy Thanksgiving, everyone.